The U.S. Surgeon General is calling COVID vaccine misinformation an imminent and insidious threat. That very stark warning was prompted by a nationwide surge in cases of this highly contagious Delta variant.
In a public advisory, Dr. Vivek Murthy says false information shared on social media is a serious threat to public health that is driving vaccine hesitancy. He wrote that misinformation is fueling fears about possible side effects and led people to decline COVID-19 vaccines. Nearly 56% of Americans have received at least one vaccine dose. U.S. Surgeon General Dr. Vivek Murthy joins us now. Good morning. Thanks for being with us.
Good morning.
What action do you want to see taken to effectively stop this misinformation?
Well, yesterday I issued a Surgeon General's advisory on health misinformation because I'm deeply concerned about the impact this is having on our health. And to be clear about what this is, health misinformation is information that's false, inaccurate, or misleading about our health, according to the best evidence at the time. And as a doctor, I've seen the impact that this has had on patients. I've seen people struggle to make medical decisions for themselves and their families because they can't make sense of the conflicting and often false stories they're seeing on social media. But the good news is that there is something we can do about this, but it's going to take all of us working together. Individuals, for example, can check their sources before they share stories online. Is it coming from a scientifically credible source? Mm-hmm. And if you're not sure, don't share. But we really need our tech companies to step up here as well, because we know that so much of this information is being transacted on technology platforms.
Dr. Murthy, in our reporting earlier in this broadcast, it came out that this is actually sourced back to a relatively few initial sources. Do you have any sense of why this misinformation is being spread?
Well, it's an interesting question, and there are several reasons, but two that I'll point out to. In some cases, there are people intentionally trying to spread information, sometimes for financial gain or for political reasons or for other reasons. But we also know that much of the misinformation out there is often spread by people who actually don't have bad intentions. There are people like me and you and others who are listening today who might see a story that they think is alarming and they think sharing it with their network might be helpful to them. They may not realize it's false. And that's why in this advisory, we specifically point to the steps that individuals can take to pause before they share. But it's also why technology companies have a really important role here to play in identifying super spreaders of misinformation, in stopping their activity and spread of misinformation online. And it also helps in being more transparent, so we understand just how much misinformation is being transacted on these platforms and what strategies are working to stop it.
Part of the reason why I think, Dr. Murthy, it's so confusing, let's start with Los Angeles, where now, even if you're vaccinated, you have to wear a mask. It just seems like the rules keep changing because we're always told if you're vaccinated, you're safe. I call it my superpower. It protects you. So why do vaccinated people also now have to wear a mask in Los Angeles if supposedly you're safe with the vaccine?
So, Gayle, you're pointing to a really important issue here. We've seen this as a challenge throughout this pandemic, which is that as science evolves, our guidance has to also evolve. Mm-hmm. But if we're not able to communicate that with enough context and clarity and consistency, then it can lead to confusion. And right now with masks, for example, one of the things we know is the science tells us that if you are fully vaccinated, that's 2 weeks after your last shot, your chances of getting sick and transmitting the infection to somebody else are low. That doesn't mean zero, it means low. So there are certain circumstances where if you have a lot of virus in your community around you, or if you are somebody who lives at home with people who are unvaccinated, that you might choose to continue wearing masks. And localities like LA County or other counties that are looking around and seeing cases rising and seeing large portions of people unvaccinated may choose to put measures back in place like mask requirements. And that flexibility is okay. But what we've got to do is consistently, clearly, and transparently communicate with people about what these rules are, why they may be shifting, because otherwise it can be very confusing.
Yeah, I was very sorry to hear, Doctor, that you lost 10 members of your own family to to COVID. I'm sure you tried to convince them to get the vaccine. So what do you say to people that just don't get it?
Well, Gayle, first of all, thank you. And my family members who had passed away, unfortunately, due to COVID, they didn't have a chance, actually, to get fully vaccinated, the vast majority of them. And I think so often about things could have been different if they did have a vaccine available to them. But for those out there who are still unsure of whether they should get vaccinated, number one, I try to listen. to their concerns. It's something I was taught earlier in medicine. You don't judge people for their beliefs. You listen to them. You try to understand. And then I also try to make sure that they have access to the information that science actually guides us to understand about this vaccine, not the myths that are out there, the myths that 2/3 of unvaccinated people, unfortunately, either believe or think are true, but the real facts. And the facts are this, that these vaccines are our single most powerful pathway to ending this pandemic. They've saved thousands of lives already. The benefits of vaccination certainly far outweigh any rare risks that come with them. So as a doctor, I urge people to look at the data, make the best decision for yourself and your family, but know that they're saving lives right now.
Yeah, I hear you, and we will keep repeating that information as often as we need to. Thank you so much for joining us this morning.
Thank you.